I'm the moderator for today's webinar. Thank you for joining us today, and you'll hear a lot about user-centered design. Here at Patagonia Health, one of our product core values is to build an easy-to-use, innovative product with a complex workflow for the public health departments. And while our out-of-the-box solution is already very public health focused and has a lot of strength toward that, we do fully understand that not all health departments are alike, and they don't all serve offer the same services and whatnot. So before we begin the webinar, I'm going to go ahead and go through some of the housekeeping details on the GoToWebinar screen. You'll see the red arrow that will shrink and expand the dialog box. Usually we go through the webinar presentation and we'll collect all the answers and questions and answers at the very end of the session. But anytime during the session, you can type in your questions in that questions box, and we'll monitor those as we're going through that. And you can shrink and expand that box to get it out of your way. But again, you'll be on mute throughout the whole presentation. So if you have questions, just feel free to type those in and we'll address those. Today's presenter is John Ramsey. He is our Chief Enterprise Architect here at Patagonia Health. His role at Patagonia Health is to engage with the customers and the developers in our internal team and other members of the leadership team to facilitate development of improvements in a swift fashion and add new features to the software. And we do this to meet the real needs of our customers. John is going to share some of these stories of the projects that we've worked on with our customers in the past and how we manage that custom development process, all while keeping the customer in the center of everything we do here. So without further delay, I'll go ahead and pass this over to John, and we can move into the presentation. John?
Good morning. Good afternoon. As Monique mentioned, that I am the Chief Enterprise Architect for Patagonia Health. I have been doing software development and support since the mid-90s, and going back even farther than that, non-professional. And then I've worked with large and small companies doing support, development, product management, business analysis, all around software development. I've worked as an independent consultant, helping people who have just beginning ideas to build SaaS applications, software as a service applications, from beginning to end, database to front end. I've also completed an MBA in 2011, and I still maintain active academic interest in the innovation process, and I work with organizations in the Research Triangle Park region to support entrepreneurship. In healthcare, I've been working in software since 2007, or healthcare software since 2007, first in the clinical trials area, and then working in back-end systems doing clinical decision support using Medicaid data to support community health. And for the past 2 years, I've been working with Patagonia Health. I actually have been following them since when they were founded back in 2008, and I'm glad to say that I've been friends with the founders since then. But I've only actually been working with them full-time since just the past couple of years. Patagonia, like I mentioned, was founded in 2008, and since 2009 has been creating electronic health records using this user-centered approach that we're going to talk about. I met with Abhi, the CTO, back in 2008. I know firsthand that the user-centered approach has been part of the DNA of this company from the very beginning, and I'm glad to be a part of it at this point. The system itself is not only easy to use, the constant improvement process and expansion of the capabilities since 2009 has put us in a position to offer a fairly inexpensive solution with a lot of capability. It's not a monolithic system. It's organized at a high level into practice management, electronic health records, and billing. And within the electronic health records, there's context for the patient, context outside of an individual patient, and reporting. All that is very flexible, and we'll show a little bit about how that works. And the point of all this is to reinforce that not only is the architecture and design of the software set to make it easy for people to configure the software the way they want it, but our processes, our ongoing processes, are set to enable our current customers and future customers to continually get improvements in the processes that they're currently doing and the things that will come up in the future. Our customers initially, any medical practice could use this software, but we've been focused in the past several years on meeting the needs of public health departments for many years. We've been expanding that to include FQHCs and behavioral health organizations, and Monique might be able to tell you more about exactly who we're serving, but I know we are continually looking at ways to expand that. So the system itself, one of the reasons it's an improvement for our customers is that software as a service in general is less expensive to purchase and maintain. So it's easier for us to provide it, and it's easier for you to maintain it. Your IT staff can focus on keeping the network going, and we can handle maintaining the security and the software updates going on the servers. It really is the best way to go, whether you're working with Patagonia or other systems. Our system is easy to use. It's set up to allow customization of the workflow for specific users and for specific tasks, depending on the responsibility of the user. So in this slide, you can tell, this is basically just a slide from our demo site, and you can get a sense of a little bit what's going on here. We have specifically the apps divided up into, or the system is divided up into sub-apps based on the function that's needed. So in this case, you can see there's a behavioral health element, there's a maternal infant health program element, there's a children's program. This screen is taken from a sample of what we're doing with Michigan. So they have a couple of programs that we created special apps for. And all of these apps can be organized and added or removed. The overlay in this screen is showing you how you can add or remove elements that you're not using. So if you are somebody who's doing immunizations and you also need to be able to take vitals, that's something you can add, and you don't need any of these other apps on the page. So you can look at the patient details, and you can look at information about the patient's flags, but then beyond that, you only need the specific apps that you need. So you can organize it that way. And this is part of the initial architecture of the system that allows this to be flexible for the workflow, depending on what the person is trying to accomplish, what the specific user is trying to accomplish. And it also makes it expandable, because as we work with new customers and they have a program that we've not done before, we can add it as an app without disturbing any of the existing apps and give the customers pretty much exactly what they need without interfering with anybody else's work. In addition, the system is configurable, and configuration is a technique that's used for two reasons. And you may have heard of this if you've talked to anybody else about software development, but in any kind of continuous improvement process, having new elements to be configurable to turn them on and off for individual users is extremely valuable, because it allows us not only to enable people to have and show elements that they might not otherwise need. In this case, there are two different ways to view the immunization widget. If you have a connection to your state registry where you can retrieve information and send information, you have buttons that would show up for you that won't show up for somebody who doesn't have a connection to their state registry. So that's a use for individual users who ongoing would have different needs. But in addition, when a new feature is rolled out, which we do on a regular basis, our schedule of rollouts is a 6-week schedule. So we develop new software, test, and release every 6 weeks. And so if we want to be able to roll out to selected users who are piloting, configuration is the way to go. So we set it up and configure it for the pilot users. We let them use it and work out any kinks that might be there, or suggest additions that might be made. And then we eventually roll it out and make it either available or just open it up to everybody. So the system is not a monolithic system. It breaks out into specific workflows that you might need. So tuberculosis might be a specific app that you would either use or not use. But it's not just a file cabinet, and it's also not just a spreadsheet. So to go far the other extreme, if we were to make the system completely flexible, so it was completely you had to configure it for yourself from the start, then we're putting all the work on you. In our case, for the specific needs, we've got apps that we can add and remove. There's some configuration, but we're not putting it all on you so that you have to really rebuild your own EHR from the pieces that we've given you. And like I said, it's not just a file cabinet for electronic documents. I've worked with systems in the past where the entire system was set up like a file cabinet, but you needed to know what the filing system was. And if you wanted to do your workflow, you had to go through menus and menus and menus to get to each next thing. You had to have a paper sheet next to your computer to tell you what the next thing in your process was, where it would be found. That's not the case with our software. It's designed to be usable and more user-friendly in the sense of being able to help with the workflow. Now, in some cases, we do have the need for that. I mentioned on this previous slide, we were talking about the Michigan forms. In these programs, a lot of what they've done in the Michigan's maternal and infant health program, it's a state-defined program that is document-based. And even though we would prefer that they go on a electronic, more fluid process, they are required to have these documents. And so we can actually set that up and so they can file each of the documents that they need for that program. So actually, this slide I did not create. I stole this off of Wikipedia, but I thought it was a good reflection of what user-centered design looks like. It's not very clean. It's a messy process, and I'll show you our process, but it's never actually the same twice. It's a lot of collaboration with the customers. It's a lot of discussion with development and back to the customer, and it's an iterative process. So we go through the initial requirements gathering, and then we do some design, we get it out to development, we do something, we get it out to users, they use it, and then we do it all over again. We try not to make it a constant process of iteration. We usually, the ideal is for us to go through about 3 cycles of our releases, which is a 6-week cycle, so it's an 18-week process typically for a medium-sized project to go from starting point to design to having something out where the users can use it to having revisions in where they have a working system. So just to give you an idea of our specific process, like I mentioned, we're doing this continuous delivery where every 6 weeks we're doing a release, and so the actual schedule of releases and making available to the customer and piloting, all this is done on a schedule that we have set up a year in advance. But the process is the same, and at whatever point you enter the cycle, the first thing we do is we have analysts working with the customers to understand their needs, and that means collecting documents. That means so documents are like things that they're using to fill out assessments. So we collect these kinds of documents. We talk about reports that are necessary. So a very important part of the whole process when working with someone is, what does the reporting process look like? If we don't know what the reports need to look like, we don't know what data needs to be collected. And so that's an important part of the whole process, even early on. In the end, we do usually do the reports, develop the reports last, but we need to know ahead of time what's going to be reported on so that we can make sure that that data is collected. So we go through the initial process, and we actually do a lot of travel for this. We could just sit back here in Cary, North Carolina, but we do travel constantly, and we have people on site working with users to understand their specific workflows and what programs they're working with. Every state is a little different. Every county is a little different, and we find that going there is actually helpful. So we often go on site and work with customers. Of course, I also do a lot of teleconferencing to make sure we can keep touching the customer without having to travel all the time. But once we've done the initial gathering of the information, then the next step is for us, and I didn't mention that we do have a plan. I did mention that even though this is we do have a standard process for our plan development, everyone is different. So once we've laid it out, we also then end up modifying it as time goes on. So the first thing we do once we've had the chance to hear the requirements is then we look at creating mock-ups. And these are deliberately made using tools like we use Balsamiq, which is a tool for drawing pictures, essentially, that it keeps us from getting too far down into the development cycle or getting stuck on development techniques in order to be able to deliver the solution. So the mock-ups look like this. For instance, this is one where we've taken an existing screen and just added a piece that wasn't there before. So most of this is a screenshot of the actual product, and then there's one piece that's been added to demonstrate something that the customer wanted to add. In other cases, we're developing the entire screen. So even though the background has a little bit of what looks like the system kind of as an image, most of this is a drawing that's done in Balsamiq. And this was based on feedback we got from, or collection of information we got from customers about requirements, along with information about how we do our progress notes and put together into a specific process. And this can be generated, and this document is used actually for two purposes. We go through this cycle with the users to get feedback on what this looks like. We try to make it a little interactive so they can kind of get a sense of how it's going to interact. But then we also once the users have given the nod on this, we actually pass this off to developers along with a little bit more documentation describing what the users have said about how it should function, so the developers can use this as a guide as well, and everybody's working off the same page. So once the users have agreed on this, mock-ups represent a solution that meets the requirements, and we're not rigid on this. So the idea is that we all know that there may be mistakes made, but the idea is that in principle or in content, we're saying that this is a completed solution. Then it goes to development, and we go through that. The mock-ups are go into more technical design documents, and we process all the way to a release. Sometimes I add a step in here where, very close to the first release, I'll review with the customers in a test environment so they can see what's coming in the first release. And I say first release, I mean first release of this product. We're constantly doing releases, but in the first release of the new piece, it's usually not complete unless it's a very small piece. And so when we deliver it, it's good to have them at least see what's coming. We can maybe do a couple of tweaks at the last minute if necessary. But then it goes out into production, and at that time, we expect the users, we really require the users to start using it. It's not enough for us to put it out there and then have them come back 6 months later and say, well, we actually weren't using it, and we just now realized it doesn't do what we wanted to do. We really require that they use it, and in the first couple of weeks after it's released, we press for feedback. And like I said, we have a 6-week cycle, so within those first couple of weeks after the release, we want to collect as much feedback as possible and feed that right back into the next release, rather than letting it go long enough that we end up having to go 2 cycles to be able to get the changes in. So in the first couple of weeks after a release, we are very much on top of things to collect feedback, and we get those revisions into development. And then if everything goes well, then for a medium-sized project, it's going to be probably up to 6 weeks or more for the design, then the first release, and then on the second release, we'll have covered most of the bases. And if there's anything left to do, it's just minor things, and maybe reporting. Like I said, we usually lag a little bit on reporting so that there's some data to report on, so we can validate the reports a little bit better before we try to put it in production. So just to give you an idea of what we have done in the past, so we're based in North Carolina, and we have a strong presence in this state because of that. And we worked very closely with public health in North Carolina. We have a very strong user group in North Carolina, and we've used that to build a lot of the aspects of the software early on. But we've then since expanded to other states and are building user groups there, which have also been very helpful. in being that every state is a little different. The programs are different, the requirements are different, the ways that we can connect with state agencies are different. So in the case of the registry, although there are standards for immunization registries, there's still a little bit of flexibility on how the state can implement those standards. And so we are pretty good about meeting the state where they are and adapting our software to be able to work with whatever state immunization registry or HIE that's out there. I mentioned immunization. That's an area that public health uses a lot. I skipped the TB app. I don't really know. Wasn't involved with the TB app development, so I don't know many stories about that. But immunization has been one that I have been very much involved in, and we have found that as we move into different states, each state has a slightly different way of doing their immunizations, and they have different information that's available from their state. And we found, especially, that with some practices, there are technical folks who are also good at explaining what they need, that were very helpful for us to be able to develop new apps that then everybody has enjoyed. So those few counties that have the resources to be able to really help us to explain their needs are very often helpful to the other practices that we work with. In particular with immunization, not only the immunization user interface has been modified over the past couple of years to make it easier to add patient history and quickly add immunizations and using barcode scanners. We have integrated with inventory. We have billing features that allow that if you enter the information in the inventory, then once it's administered, that information will go on to billing in the form that the provider or the insurance provider is going to want to see, the payer will want to see, to be able to ensure that the inventory is according to their requirements. We have HIV case management. We also have been expanding quite a bit in Michigan and in some other states regarding case management in general. So there's a lot of different kinds of case management in public health. In some cases, people are providing services that are non-clinical. In some cases, they're determining for themselves that work needs to be done under a certain program. Sometimes they're external agencies like the primary care provider is prescribing services that the public health department provides and can bill for. So all those variations, we're working on case management solutions for. We're supporting the HQHC and we're supporting reporting. All these were based on collaborations with customers that were doing this work, and we wanted to work with them, and we went through the cycles to get it done. As I mentioned, we do have releases every 6 weeks, and every 6 weeks there are real improvements to the system. And you can imagine that starting in 2009, with the first release, it's been an ongoing process like this. Every 6 weeks we're adding new functionality, and so the system has gotten quite fully featured. So I think that is has explained how our system has been used both in the past and current and in the future to provide a more personalized solution for our customers in order to meet their workflows and meet their specific state needs and the requirements for the patients and the reporting that they have. So at this point, I will turn it over and open up for questions.
Okay, thanks, John. If anybody has any questions, feel free to go ahead and put those in the questions box, as I mentioned at the beginning. John, can you just clarify just briefly on the releases on the new apps and the new updated features for personalizing certain systems? The every 6 weeks is EHR as a whole, all of our EHRs, and you clarified that at the end a little bit. And at the beginning, when you were talking about the apps, the app development, does that release on the 6 week apps, on the normal release 6 week cycle?
So the only thing that's off of the normal 6-week release cycle is our billing system. That's on a different cycle. And that goes out, so we issue separate release notes, and that goes out on a different cycle. But everything else is on the 6-week cycle, and very rarely there will be things that need to go out in between that we can do before the actual official release, but it's only for either something that's really broken that needs to be fixed, or something that's either minor, like just a visual aspect that can be changed without affecting the actual functionality.
Okay. And then just also I wanted to just clarify, is this something that the design development process is done for customers specifically, or have you ever done things for non-customers or prospects?
Yeah, absolutely. So what happens is we get feedback not only from our customers, but we get feedback from support, indirectly from our customers through support. We get feedback from our testers. We get feedback from salespeople. We get feedback from marketing, where we hear about things that people might need. And so not only do I actually help with the design process, but one of the things that my group does is we'll just do a hypothetical, right? So for instance, in the case of ID scanning, right, we're in the process of looking at that now as a feature, a full feature, but we did the initial analysis on the feasibility of that and what would be necessary a long time ago, and basically packaged that up and set it aside and waited for someone to actually ask for it. But we had done the initial work to kind of feel it out to see what it was going to be a long time ago. And we do that regularly with all kinds of features that we hear about. But unless we actually have somebody who is wanting it, we don't just build it because we think it might be neat. We do build based on what our customers need, but we're also very aware ahead of time what they might need.
Okay, good. Now we do have a question. With the release, are all apps available to all clients?
I'd say yes. I don't know the exact way that the sales process goes, but there are some pieces that are sold separately. So the system as a whole is set up to be able to support all of the apps, and everybody should have that capability. Now, some of the pieces that are configurable that can be turned on and off are separately priced. So that would be the only, I think, difference between people who have something and don't.
Or also some are state specific, and if it's developed for, say, Michigan, it wouldn't be available to
good point.
Virginia, for example.
Yeah. So we don't have apps in there. Certainly we turn it on and off for people. But if we've developed something specifically for a Michigan program, say for instance the Michigan Maternal and Infant Health Program, that program, I'm not sure if it's technically state-run. It may be a private program that the state has adopted, and in that case, other states could use that program, and somebody could actually be using the same program and just use this app. They wouldn't have to be in Michigan to use it, and we wouldn't we wouldn't necessarily be charging extra for that piece if we've already done it, and it's not something that's costing us the extra. I don't know how the pricing goes, but the answer is everything could be configured and available for everybody if they wanted it. Yes.
Okay, I don't see any other questions coming in, but I'll hang on for just a few more minutes to see if anybody does have anything they're typing. Sometimes it takes a while to get them typed in. We are having a repeat of this webinar on Friday at 1 o'clock. If you have anybody else that you think would benefit from registering for the webinar, again, this Friday at 1 o'clock. We do have another webinar scheduled for August on security risk assessments and what to expect if you have to run that analysis in your agencies. And that is listed on our website under webinars as well. So we'll get that out to you. So again, we'll just hang out. John, thanks very much for your time here, and very well presented. Appreciate your time.
Yeah, and I guess for everybody who's on now, if they want to come back for Friday, I just like these projects, I would have to say that it's never going to be the same twice. I think when I give this presentation on Friday, it'll be a lot of the same content, but I'm bound to think of something else that we want to cover. So
Great. Okay. Well, thanks very much, everybody. We'll send out a recording of the webinar as a follow-up in your email. So thanks for attending, and we look forward to having your attendance at some of our future webinars. Thanks very much.